day everyone. Today's session is about the other environmental influences that affect on the fetal development. The recap of the previous session is some of the important environmental influences and their impact on prenatal development are as follows. Pregnant women having children in the later years of age are more likely to at risks to the infant's health. Environmental hazards that can affect prenatal development by causing miscarriage and more preterm births include chemical radiation, extremes of heat and humidity, chemicals exposed to semiconductor chips, DDT, high levels of lead, etc. Other maternal illnesses that can affect pregnancy are infections, flu, urinary tract and vaginal infections, sexually transmitted diseases, thyroid deficiency, rubella, toxoplasmosis, herpes, radiation, etc. The learning objective of today's session is to understand the importance of environmental influences on prenatal development. To understand the influence of different paternal factors like father's exposures to cocaine, marijuana or tobacco, smoke, lead, large amounts of alcohol or radiation, DES are certain pesticides, lead and paternal age on prenatal development. The session outcomes are students would have understood the importance of environmental influences on prenatal development, the influence of different environmental paternal factors like father exposure to cocaine, marijuana, tobacco smoke, lead, large amounts of alcohol or radiation, DES are certain pesticides, lead and later paternal age on prenatal development. Paternal factors. The father too can transmit environmentally caused defects. A man's exposure to marijuana or tobacco smoke, lead, large amounts of alcohol or radiation, even a drug called DES or certain pesticides may result in abnormal sperm. Men who smoke at increased risk of impotence or increased risk for impotence and of transmitting genetic abnormalities. And a pregnant woman's exposure to the father's second-hand smoke has been linked with low birth weight and cancer in childhood and adulthood. Men with high lead exposure at work have an elevated risk of fathering a premature baby or one with low birth weight. Offspring of male workers at a British nuclear processing plant had an elevated risk of childbirth. A man's use of cocaine can cause birth defects in his children. The cocaine seems to attach itself to his sperm and this cocaine bearing sperm then enters the ovum at conception. Later, a paternal age, that is usually averaging in the late 30s, is associated with increased risk of several rare conditions including Marfan syndrome, that means deformities of the head and limbs, and dwarfism. Offspring of male workers at a British nuclear processing plant had an elevated risk of stillbirth. A man's use of cocaine can cause birth defects in his children. The cocaine seems to attach itself to his sperm and this cocaine bearing sperm then enters the ovum at conception. To summarize this session, paternal factors influencing on prenatal development are exposure to marijuana or tobacco smoke, lead, large amounts of alcohol or radiation, DES or certain pesticides. Men who smoke are at increased risk of impotence and of transmitting genetic abnormalities. Men with high lead exposure at work have an elevated risk of fathering a premature baby or one with low birth weight. Men exposed to nuclear plant had an elevated risk of stillbirth. Father's use of cocaine can cause birth defects in his children. Paternal age is associated with increased risk of several rare conditions including Marfan's and dwarfism. Thank you.